This video is looking at how to safely mount a needle onto a needle holder using the recommended no-touch technique. The example shown here would be if the surgeon was right-handed and the needle were to be used in normal tissue, so essentially the most common method. At the end of the video, there are some examples of some alternative methods. Before we get on to the practical element, it's probably worth recapping some of the key terms that we're going to be talking about. So let's remind ourselves of the anatomy of a suture needle. In this image, you'll see the needle itself, and then the black cord running from the right-hand side of the picture represents the suture material. So the first term to consider is that junction between where the suture attaches to the needle, and this is called the swage. The length of the needle is measured from the swage to the needle point. And you'll notice that in this example, the needle itself curves through 180 degrees, and this is known as a half circle. There are, of course, other examples available, for example, quarter circles and 5/8, and some needles are simply straight. You will also find variation with the shape of the diameter of the needle and the needle point as well. This is because suture needles are used in a variety of different ways and are adapted for different tissue types as well. Fortunately for us, all of the pertinent information is written on the front of the suture packet. And here is a brief summary of the things to look out for. So let's get on with the demonstration. For this, we're going to need a needle holder, some forceps, a kidney dish, and obviously the suture itself. The first thing you'll want to do is open the packet, and the best way to do this is just to tear away the corner to expose the beginnings of the needle itself. This allows you access with the needle holder, but saves you having to unpack the whole suture. So we're going to grasp the suture in the jaws of the needle holder and withdraw it from the packet. It's entirely likely that you'll need to move the needle because it won't be in the correct position. It's best practice not to touch this with your gloves, so use the forceps to manipulate the needle into the correct position. When positioning the needle, keep in mind the rule of thirds. So if you start at the swage, the needle holder should be grasping the needle approximately 1/3 along its length, and the needle itself should be situated approximately 1/3 of the distance from the tips of the needle holder. Once the needle is securely mounted, it's ready to be passed to the surgeon. The safest way to do this, avoiding a needle stick injury, is to use a kidney dish. Carefully position the needle holder with the handles facing towards the surgeon and the point of the needle facing downwards. When passing the instrument, it's a good idea to keep your hand on the underside of the kidney dish rather than on the edge. This further reduces the risk of a needle stick. Whilst using the kidney dish is the safest option, there may be some instances where this is not possible. If this is the case, make sure that the point of the needle is facing up and keep the hands on the undersurface of the needle holder. If your surgeon is left-handed, you will need to orientate the needle in the opposite direction, but of course the rule of thirds still apply. If the needle will be passing through very tough tissue, like a tendon for example, it may be necessary to slightly change how the needle is mounted. In this example, the needle holder grips the needle about halfway along the curve, but it's still held at 1/3 of the way into the jaws. Thank you very much for watching the video, and if you're enjoying this content, please click like and subscribe.